This fall, families will have a new option to protect their babies from a virus that attacks the lungs. It's called RSV. This new protection is different from what we're used to hearing about. It's not a vaccine. It involves an antibody. Joining us now is Dr. Mobeen Rathore. He is chief of UF Health's Division of Pediatric Infectious Diseases and Immunology. Good morning, Dr. Rathore. Thanks for being with us.
Good morning.
So would you explain how this antibody works to protect babies from getting RSV?
Yes, so this is very exciting news that we now will have an additional tool in our toolkit. You can think of this antibody almost like a vaccine. In a vaccine, you give a shot and the body responds and produces these antibodies to protect you against infection. In this case, since the babies are too little to have that response, they're actually given the antibody to protect them against the infection. And this antibody has been generated in the lab, if you will, and it helps protect the babies. The exciting thing on this really is that we have something right now we give, but you have to give 5 doses, one every month throughout the season. This particular one, you only have to give 1 dose, and that's the exciting part.
So I'm thinking about the mama bear in me. So be patient with me, Dr. Rathore, and moms that have babies that are very, very young and wondering, wait a minute, is this new? Is this safe? Has this been tested? I don't know about this. How do you address that concern?
Well, first of all, it's very safe. Remember, RSV is a very serious illness, as we have seen in the last couple of seasons. It's been a very bad seasons, and babies have gotten sick, have been in the hospital. Currently, we give it to those babies only who are at high risk for developing serious disease and even getting hospitalized and even die from RSV. I think the next few weeks and months you'll hear whether the CDC and the American Academy of Pediatrics recommend this for all newborns, all infants, so we can protect everyone. Don't forget, even though those premature babies, those babies with certain heart disease and lung diseases, newborns are at high risk. Every child, it's a sort of a rite of passage. Every child, by the time they're 2 years of age, get this infection. And in fact, a lot of the children we see with serious RSV infection who are hospitalized, they are the ones who are not in that group of high risk, premature, chronic lung disease, chronic heart disease babies. So any baby can get it. So the mothers and families have to be very comfortable. This is a very safe product. It has been shown to be safe. And really, the important thing to remember is we already are using something like this right now. This is just an advance on what we are already doing. And now perhaps we'll be able to give it to all babies and protect all babies, not just for those who are at high risk.
And I want to point out, because there is currently, as you mentioned, something that is being used, as you mentioned, but it has to be given every month. But that's only being given to babies that are considered vulnerable. So that's how you're referring to this other option that's available, that's not available to all babies right now. And that's the difference with this particular drug that's being used. That said, then, Dr. Rathore, when would parents be having this conversation with their pediatrician and determining whether or not this would be best for their child?
Yeah, I mean, we would like to have it right now, wouldn't we? So we can protect all our babies from this terrible infection. So the first thing is it has to be available. It was just approved yesterday. I'm sure we hope and that it is going to be available before the RSV season starts, which traditionally is starting in September, October. And then I think it's important that we also have to wait what the recommending professional organization, the CDC, the American Academy of Pediatrics, what they recommend. But the product, we are very hopeful, is going to be available very soon and before that dreaded RSV season starts, so we can then deliver it to the babies. As far as the parents, they should talk to their pediatricians now and ask them when they think that's going to be, if their child is eligible, and I think be ready to take their child into the doctor's office or another place where this vaccine is going to be given. You can think of it almost like a vaccine, although it's not really a vaccine because it prevents the RSV infection.
Dr. Rathore, thank you so much for your time this morning. We appreciate it.
Thank you so much.
We'll be right back.